Well, for more on this, we're now joined via Zoom by Professor Salome Charalambous, who is the Chief Scientific Officer at the Aurum Institute. Thank you very much indeed for joining us and welcome to the program.
Hi, Peter. Thank you very much for having me.
It must be disappointing that your conference would start under a cloud of monies coming from the tobacco industry.
Yes, no, it was disappointing. I think it's been a difficult last 2 weeks, but we as the conference organizing committee made the decision that it was more important to go ahead with the conference. It's really a very important conference for us as a country. After having 2 years where their focus has really been on COVID-19, and this has seen a rapid decline in TB testing, and we feel a lot of setbacks for the TB response to the country. And so we're finally getting ourselves up and running again, and we have a TB response for COVID-19 and are planning on a national TB strategic plan. And this was very important that we still went ahead with the conference with the stakeholders that are still able to participate, which is a very large number. And so we made a decision, that was a unanimous decision to go ahead.
All right, last question on this, because I think there are more important things to talk about. But I suppose that, yes, it's politically, it's just one of those things. Hot potatoes, tobacco money is a no-no. But could these stakeholders, could they have perhaps looked at the greater good in that the people with TB, suffering from TB and might get TB are much more important than some of these political questions?
Well, I think that many of these organizations have rules, and they hold themselves to those rules and abide by those rules. So we understood the reasons for their decisions. But at the same time, we felt that on our side, many of the organizations in South Africa were still going to support the conference and have supported the conference. And so we decided to go ahead. That was how we saw it.
All right. So what's big on the agenda at conference this year?
Yeah, I mean, we have so many interesting parts of TB that are coming up. We have, firstly, our TB response strategy, which is looking at many innovative tools that some of them have come out of the COVID epidemic, and we're hoping to use them in our TB response. In addition, there are new strategies for finding TB cases. There are now shorter regimens for TB treatment. There are shorter regimens for drug-resistant TB treatment. There are improved ways of working with healthcare workers. So all these different aspects we're hoping to discuss during this conference, and we're hoping that those are going to be taken back to the communities and to the clinics and implemented. And that's really our big thrust, is to ensure that all the new technologies and new innovative strategies are now implemented throughout the country to be able to improve our response to TB and save people of TB disease and the devastating impact that has on people's lives.
So where are we in terms of, I won't say post-COVID, but certainly at a recovery process from COVID, because there were concerns and reports that HIV, TB, and other diseases and combating other diseases was badly affected by the pandemic, and that people weren't taking their medication, they weren't receiving the help that they needed. Where are we on that journey after the worst part, if I can say that, of COVID-19?
Yes, during the 2020 was really a devastating impact of COVID on TB. So we saw the TB testing reduced by almost to 40% of what it had been previously during the months from March to October 2020. In 2021, we attempted to recover. We still did not really achieve the previous levels before COVID, but now in 2022, we really are seeing some promising impacts. Dr. Harry Moultrie from the National Institute of Communicable Diseases presented today and really showed that testing levels, at least for TB, have now gone above what they were in 2019. The impact on treatment, we feel is slightly less. We feel that the clinics have tried really hard to keep people on treatment, although there has been an impact on people staying on treatment and remaining on their therapy, on their regimes through this long treatment period that is a TB treatment period. But the largest impact, we think, is on people being tested for TB, and we now are making a recovery. What we are, as I've said, COVID also brought in new technologies, new ideas, new ways of thinking, and we're looking at some of those are already being implemented, and we're looking at a great response following this conference, with people having the knowledge of what's available and being able to put them in action in health facilities and throughout communities in South Africa.
There's always been a concern, of course, of drug-resistant strains of TB. Is that a major issue for us? Is that something that we're managing?
Well, drug-resistant TB will always be, has always been a problem in South Africa. We have, over the years, have had approximately 10,000 drug-resistant patients per year. This has been declining, and the last few years are seeing reductions to around 6,000 per year. And this seems to have stabilized over the last 2 years. So we are hoping that, despite all the disruptions of COVID-19, that we are not seeing at the moment any indication that the drug-resistant TB cases have increased. What we have been able to do during this time period as well is try some new regimens for drug-resistant TB. And in fact, South Africa tried the 9-month oral regimen, which is a 9-month treatment rather than an 18-month treatment for drug-resistant TB. And that has led to international guidelines being changed throughout the world to make available this 9-month regimen due to the good response that we were able to show in South Africa. So treatments are getting better. There's now a 6-month regimen on the horizon for drug-resistant TB. So we're hoping that with that, as we're able to increase treatment success for drug-resistant TB, we will then reduce the transmission that can take place, and so reduce the numbers even further. So we feel that we are getting on top of it. It's not yet completely under control, but we're getting on top of drug-resistant TB.
Professor Charalambous, we're going to leave it there for today, but I'd love to chat to you again after the conference just to discuss the outcomes and what you've decided as a way forward. Perhaps we'll do this again maybe early next week.
I'm very happy to do that with you, Peter. Thanks very much.
Right. Thank you so much indeed. That's Professor Salome Charalambous, who's Chief Scientific Officer at the Aurum Institute. The TB conference taking place at the moment in Durban that was nearly threatened with being derailed by key players pulling out, but they soldiered on and they said we must still do the work. We'll have an update at the end of that conference for sure.